first, it's drug distributors. It's not the drug manufacturers themselves, but yeah, there some congressional lawmakers. They've been investigating this sort of what's called a gray market. These are, small drug distributors who are, trying to buy up drugs that are in short supply. There's, currently a nationwide shortage of drugs that are primarily used in hospitals, older chemotherapy drugs, drugs used in, critical care units. So some of these smaller companies have been going around trying to buy these drugs, and then they turn around and sell them to hospitals at vastly inflated prices. And so that's the segment of companies that the lawmakers have been trying to, figure out what's going on.
So basically, these distributors have access to a direct pipeline, I guess, from the drug companies, and they're using that I guess that advantage to run up these costs. How can that be legal, and how what do lawmakers want to do?
Well, some of these companies set up, at least at the time, some of these companies set up legally under state laws. They set up a pharmacy, and they obtained a pharmacy license by having a licensed pharmacist, and then they said, okay, well, we're going to sell drugs to long-term care facilities or nursing homes. Well, so they were able to obtain their license that way, but what they were really doing was getting drugs from larger drug distributors legally, who were selling to the pharmacy, thinking this pharmacy is legitimate. Then they were transferring it to their own, smaller drug wholesaler, and then it often changed hands a couple more times before it was then ultimately offered to hospitals for sale at, several times the original wholesale price.
So why aren't the hospitals going direct to the wholesaler or the drug manufacturer? Wouldn't that solve this problem completely?
Well, they are. I mean, they are. They're trying to get all of their drugs through their main, wholesalers, and they say they're being called and emailed by these smaller companies offering drugs that they can't get, that the hospitals can't get from their big wholesalers, and they're wondering, how can these little guys get it? Now, most of the hospitals I've talked to have said that they don't purchase drugs from these smaller distributors, but clearly somebody out there is buying those drugs. Otherwise, you wouldn't have this market. But some of these smaller pharmacy distributor operations have been shut down. One that was, I guess flagged by lawmakers in North Carolina was shut down. In that case, the state, they say they go out and inspect wholesalers every single year. And on the last inspection, they noticed that, hey, wait a minute, there's a pharmacy in the same building. This just doesn't look right. So that operation was actually shut down last year.